Hello, my name is David Robinson and I am the Director of Education at Bradford Teaching Hospitals NHS Foundation Trust. I'm also a consultant in emergency medicine and I'm here to deliver the induction talk for you. For those of you who are new to Bradford, then massive welcome. For those of you who have worked in Bradford before, then welcome back. I really hope you all enjoy your time here in Bradford. I'm going to try and make this presentation as brief as possible because I'm aware you're observing it on a screen, so it's not as interactive as it otherwise might be. So, welcome to Bradford. Some key things I'm going to talk about during the course of this presentation. First of all, our trust values, a very brief overview of your induction. Then I will describe some of the education services we have in the trust, some of the facilities we have here in Bradford. I'll take the opportunity to very briefly talk about some key clinical issues, bearing in mind some previous incidents that have happened in the trust. So I'll talk about news scoring, allergy, sepsis, antibiotic prescribing. Mention handover and discharge, consent procedures in the trust, education and clinical supervision, pastoral support for you as employees and trainees, and finally some advice on safe use of social media. So first of all, welcome to Bradford. As lots of people describe Bradford as a teaching hospital, that doesn't necessarily have a teaching hospital feel, feels a bit more like a district general hospital, which I think is very true. We're very proud to be a teaching hospital, host medical students from Leeds University, be a great place for training for postgraduate doctors in training. But it's also a very friendly hospital. So you'll recognise people in the corridor, you'll hopefully stop and have a chat. There's a good team spirit within the trust, which isn't always the case in large teaching hospitals. I think a really important thing is that as far as the trust is concerned, education is really important. So one of the trust's key visions is to be an outstanding provider of education. And happily, our current education survey feedback is reasonably positive, and we very much want to continue that and to continue to be a great provider of education. So this is your trust induction presentation. You'll also have been asked to complete some mandatory training, so some e-learning, which I'm afraid is very much a tick box exercise and needs to be done. So you'll be asked to complete some training for NG tube, diabetes, infection control, safe injectables, etc. For new foundation trainees, you'll also be asked to complete script e-learning modules, and you'll all been asked to complete EPR training before you commence work. We also offer face-to-face EPR training, and the EPR training team are more than happy to offer further training should you require it, and run drop-in sessions once you commence work if there's any further bits of the electronic patient record that you need to cover. For those of you that are new to the NHS and new foundation doctors, we also do some clinical skills training and some competency assessment before you start in the workplace. And I think as important as the trust induction, if not more important, you should all have a local induction in the departments you're about to work in and local orientation. That will follow on from the trust induction. Some key personnel within the medical education department. So there's myself as Director of Education overseeing education in the trust. I'm supported by two deputy directors, Dr. Shafi Khan, who's an ED consultant, who's also the Trust International Medical Graduate Lead, and Dr. Amy Ilsley, who is a Care of the Elderly consultant, who looks after undergraduate issues, particularly medical undergraduate. We have a simulation lead, who's Dr. Liz Jones, consultant in paediatric emergency medicine, and a technical skills lead who oversees our technical skills lab, Mr. Mal Gandhi, orthopaedic consultant. We have 4 foundation training program directors in the trust. So for FY1 trainees, you'll be overseen by Shafi Khan and Liz Jones. And for FY2 trainees, your FTPDs are Russell Ahmed, who's an acute medicine consultant, and Raghu Vinayagam, who's a consultant radiologist. We have college tutors in a number of specialties within the trust who will all be hopefully running your local induction. So you'll meet your college tutors in due course. Within the education team, Alida Towns is our postgraduate medical education lead. So she's heading up our team within the education service. And she's supported by team leader Marika Hall. So you may well receive emails through the course of your time with us from Alida and Marika around training issues and other sources of information. We're very lucky in Bradford to have good educational facilities. We're one of the few trusts in the region to have co-located technical skills lab and simulation centre up here in Field House. So the technical skills lab is full of excellent equipment to help your skills training. So those of you in surgical specialties, anaesthetics, emergency medicine, paediatrics may well make good use of the technical skills lab. We have a number of courses running there. And we have a simulation centre also within Field House, which is pretty much fully used at capacity. It operates 3 to 4 days per week. Lots of courses running out of there. We have a ward area, a resus area. We can mock up a simulated theatre environment. There's a number of discussion rooms. So we run lots of simulation courses. So please look out for information on our global email, which comes out every week, and more information on our education website. So I think if you have any concerns about what is happening at work in regards to quality of care in your environment, any patient safety concerns or any training concerns, then you absolutely need to escalate those to us. If we don't know about the concerns, then there's nothing we can do to address them. And often concerns about the workplace will overlap. So concerns around training will also involve concerns about safety or standards of care. So if you have any concerns, please do escalate them. Whether you escalate those locally to the team you're working with, or whether you escalate them via other routes, including us in education, is obviously very much up to you. But please feel free to escalate to us within education about any concerns you have, because we are here to support you. And we will do all we can to address any concerns that you raise. So important that you know where you can raise your concerns. Obviously, your educational or clinical supervisor could be another source of support for you, or your college tutor or training program director. As I said, please feel free to contact me directly if you have any concerns as well. Important to mention, our guardian of safe working hours is Dr. Jo Glaskerdine. So she obviously oversees the exception reporting system within the trust. She reports at regular intervals to the board about exception reports and trends in exception reports and what actions we are taking to address those concerns. So again, please do use the exception reporting system when that is appropriate. They're all reviewed. We run a regular junior doctor forum where we have training representatives where we discuss these issues as well. So there are plenty of sources for you to raise your concerns if required. Very briefly, I want to touch on some clinical areas. So it's important you're aware of the early warning scores systems that are in operation in your clinical area. They're obviously important in terms of identifying deteriorating patients and allowing members of the team to escalate to more senior members of staff. So you may well have other members of the team escalating, for example, news scores to you, or you may well be in a position where you need to escalate news scores to more senior members of your team. So please be aware of the protocol that operates in your clinical area. Follow that. Antibiotic prescribing. A few years ago, we did have a run of cases in the trust of patients who were penicillin allergic who were inadvertently prescribed and given penicillin. Now, with the advent of the electronic patient record, this is much rarer. There's still some important learning. Please do obviously make sure you check a patient's allergy status before prescribing medications. When you're prescribing, try and avoid interruptions and try and avoid interrupting nursing staff when they're performing medicine rounds. Checking a patient's allergy status is the responsibility of any member of the team. One important point that's come to light recently is making sure when you're checking allergy status that you're using the correct source data. So, for example, for patients who can't confirm their allergy status, we need to make sure we're using more than one source of information. So, for example, using the electronic patient record and the patient's GP records. We have an example relatively recently of a patient where one electronic electronic record did not contain that patient's up-to-date allergy information, and unfortunately they were prescribed a drug they were allergic to. So please do make sure you're using more than one source of information if the patient is unable to confirm their allergy status. You will see littered around clinical areas, penicillin allergy advice, a list of antibiotics that you should not prescribe in patients who are penicillin allergic and those that are considered safe. They're usually found on drug cupboard doors, so look out for those. And for you to be aware that we do have anaphylaxis boxes on every crash trolley within the trust. So those boxes contain all the medications that you will need to treat a patient with anaphylaxis, and also an up-to-date Research Council guideline. We also have hypoglycemia boxes. They're at various locations around the trust and in the clinical areas. So please find out where your nearest hypoglycemia box is to where you are working. Coming back to antibiotic prescribing and alerts on ice for patients with history of, for example, MRSA, C. difficile, multi-resistant organisms. Please make sure when you're looking at NICE that you check for those alerts. Obviously, there's a big focus on managing sepsis across the whole country. So again, please be aware of the sepsis 6, or Buffalo as we call it locally. So for any patients who are deteriorating, please consider sepsis. And if you think it is sepsis, then please follow the sepsis 6 and implement those as soon as you can. For antibiotic prescribing, then obviously check the history of allergies, follow the sepsis pathway, take blood cultures early, check ice for previous resistances, and use the antibiotic protocol is available on the Trust intranet. That does change regularly, is updated regularly, so please make sure you refer to it when you are prescribing antibiotics. We do have a fantastic microbiology service, so if you have any doubts or concerns about which antibiotics you should be prescribing, dealing with complicated patients, then please pick up the phone, speak to the microbiologist. They're happy to give advice to you. For those patients admitted to hospital, then please use EPR to complete a VTE assessment. Moving on from clinical items, important that I mention what to do if you're involved in an incident or a complaint. So our role in education is very much to support you through the process if you are unfortunately involved in an incident or a complaint. So for those trainees that we are aware of being involved in an incident, we will actively, from education, contact your supervisor to let them know and ask them to offer you the appropriate support. This is absolutely to provide support to you through the process. It's important that you do reflect if you have been involved in an incident and complaint, and the expectation is that you will complete a reflection and add this to your portfolio. I just ask that you make sure your supervisor is involved in this process, and you do have a discussion with your supervisor before you commit anything to your portfolio, and really ask your supervisor to review your reflective notes to make sure that the reflections that you're adding to your portfolio do actually adequately reflect the learning that has arisen from the incident. So different clinical areas will have different procedures for handover. Please make sure, following your local induction, you're aware of local handover arrangements. Please use the SBAR tool whenever possible. It's important I mention that handover sheets, so paper handover sheets, which are still in use in many areas of the trust and are very useful, please make sure they are placed in confidential waste bins on the wards and in clinical areas. Please do not take them home, as occasionally we do find handover sheets in the car park, for example, and that obviously does raise confidentiality and governance issues. When we come to discharging patients, please make sure the discharge letters on EPR contain enough information for our GPs to adequately take over the care of the patients post-discharge. Where possible, please ensure that investigations are chased up locally and acted upon. And if we're asking GPs to chase up investigations, please make sure that this is mentioned very clearly in the discharge letter. There are various local systems for booking follow-up and diagnostic virtual ward now in use in the trust. So many investigations can be chased up locally without recourse to the general practitioner. So in terms of your day-to-day clinical supervision, I think it's really important that you work within your competencies. And if you're asked to work outside your competencies, you do escalate this and make sure that senior members of the team are aware of this. It's important that you keep yourself safe and keep our patients safe as well. I think if you are regularly asked to work outside your competencies, then that's a significant concern. And I'm very happy for you to share that with us within education and for you to contact me if you feel that is the case. There may be occasions when you're asked to supervise other members of the team performing procedures, or you may be supervised by other trainees when you're performing procedures. So I think it's important that supervising and supervised trainees must have the appropriate knowledge and be comfortable to be doing what they're asked to do. And the patient obviously should be aware and agreeable to a trainee performing a procedure under supervision. I think it would be appropriate for senior members of your team and consultants to be aware when trainees are supervising other trainees performing procedures. The bottom line is to keep yourself and patients safe at all times. In terms of delegated consent, we have a trust consent policy, which does include a capacity for delegated consent. So there may be times when you're asked to consent for procedures you wouldn't normally perform. We have a prescribed list of procedures where FY1s can take consent, and then a supplementary list for FY2s where they can take some additional consent. Please make sure you're following this list. This is trust policy. If you're asked to consent beyond this, then it is a trust of the breach policy. Please do not do it. You should not be pressured to consent for procedures beyond those lists. Please inform me if that is happening. So in terms of education support, you should all be allocated educational plus or minus clinical supervisors. That should be done through your local college tutor or education lead, or if you're a foundation trainee, by the foundation team. If you're not aware who your educational or clinical supervisor is, then please contact us in education and we'll make sure it's remedied as soon as possible. Obviously, your supervisor will be there to provide mentoring and support to you and career guidance where appropriate. Bullying and harassment is obviously not tolerated in the trust, and if you're experiencing any bullying and harassment at work, then please escalate this to your supervisor or to your FTPD college tutor or to myself if necessary. And obviously we're very aware of the current workplace pressures and the mental and physical health impact it's having on members of staff. So there's multiple avenues of support for you, particularly if you're suffering with your mental health. So Take Time is a counselling service offered by NHS England, which members of staff and trainees can self-refer to. We have our own Trust Workplace Wellbeing Centre, which can also provide support to anyone with health issues. Obviously, we have more formal occupational health, and I hope that all of you are registered with a GP, and if necessary, would seek advice from your GP if you need any, if required, for any health issues. We have associate college tutors or trainee reps in as many specialties as possible, and we have a regular junior doctor forum where the associate college tutors are part of the membership with myself and the Guardian of Safe Working Hours. So there is an opportunity to apply to become an associate college tutor for those of you who are interested in education and want to support the college tutors in your areas and represent your colleagues. So further details can be gained from a leader towns or your college tutor if you're interested in this role. For those of you who'll be working night shifts, and some simple guidance here on keeping yourself well whilst working at night. so advice before, during, between and recovering after nights. There's also useful advice on YouTube, worth looking at Michael Farquhar, who's a consultant in sleep medicine in London. We have had, unfortunately, some instances of junior doctors who've been involved in road traffic collisions when driving home after night shifts. So just for you to be aware, there are short notice rest facilities available within the trust. If you get to the end of a night shift and you feel you are too tired to drive home, then if you go make your way to the main trust reception, they have some keys for short notice rooms where you can go and get some sleep before driving home. And then finally, just safe use of social media. I think it's just really important that you bear in mind that you shouldn't be posting patient confidential information on social media. Anything you post should be professional, and just be very careful in your use of social media. Again, we have had some instances of members of staff who've posted unprofessional things on social media, which the trust have discovered. So please keep yourself safe and follow the GMC guidance on the doctor's use of social media. So that's a very rapid overview of some important issues here in the trust, some important clinical items I've mentioned, and some items around your educational and clinical supervision and support we can provide within education. Also briefly touched on some of the education facilities we have here in the trust. I think the key message for me is that I really hope you can make a success of your time here in Bradford. We're really proud of our training reputation, and I really hope you have a great experience here. Make use of the many clinical opportunities available within Bradford and some of the education support that we have here. So I hope you enjoy working in your teams here. I hope you take full use of the opportunities available to you. At the end of the academic year, so usually in the summertime, we will be hosting a trainee and trainer award event. So more information about that will follow in due course. And obviously, you know where I am. If you have any concerns or any issues you need to escalate to me, or anyone with interest in education who wants to get involved, then please contact me at david.robinson@bthft.nhs.uk. So all in all, just hope you have a great time here in Bradford. And I look forward to hearing from you and meeting some of you at the Junior Doctor Forum in due course.